Looks like Governor Scott may soon get his wish. Here now is CNBC contributor and Washington Post columnist Matt Miller. He's the host of Public Radio's popular Weekend Review, Left, Right, and Center, along with Diana Furchtgott-Roth, Senior Fellow and Center for Employment Policy Director at the Hudson Institute. Diana, let me start with you. The judge ruled on something called declaratory relief. He is voiding the act. Now, essentially, is he saying to the government, do not implement this Obamacare bill, at least until it can be decided by the Supremes?
Well, that's a question for legal experts, and what the government should do is petition the Supreme Court to hear it right away to get rid of all this uncertainty. But one thing is very clear: this law is very costly, and the Department of Health and Human Services is issuing waivers left, right, and center to all its friends. Over 700 waivers issued so far. Teachers unions, longshoremen, SEIU, they're getting waivers because this is so costly. It's like Leona Helmsley, who said, as you probably remember, only little people pay taxes.
All right.
Now only little people are going to pay the health insurance
But Matt Miller, I'm not a lawyer. Diana's not a lawyer. I don't know. You're not a lawyer either.
I'm a lapsed lawyer by training.
All right, you're a lapsed lawyer. So let me ask you about declaratory relief, because in this article in the Wall Street Journal, it says that this is the functional equivalent of an injunction on Uncle Sam not to put through Obamacare. And the reason I'm asking this is not to be a legal beagle, but it is going to embolden Republicans, and I wonder whether it's going to affect Democrats as they defund and try to stop Obamacare from starting.
It's certainly going to embolden Republicans. My colleague Ezra Klein at the Washington Post was reporting tonight that the White House is scrambling to try and do an expedited appeal, apparently, because of the ambiguity as to whether this declaratory relief is the same as an injunction. My guess is when the dust clears in the next couple of days, there'll be the appeal process. This will be stayed until it goes up, and it'll end up with the Supreme Court, and we'll see what Justice Anthony Kennedy thinks is the constitutionality of it, because that's what it's going to turn on.
This decision, I mean, you've been on this show when we've had the other decisions. This decision goes further than prior decision. That's why I'm raising it. Lord knows I don't get all the legal stuff, but it sounds like this is really an aggressive step to stop Obamacare in its tracks.
It's one judge. It's one judge with a more aggressive move. It's now 2-2 among the different judges that have heard it. It's going to go to the Supremes. My real point is conservatives who want Obamacare to be killed, which I can see the excitement in so many eyes tonight.
In my eyes.
In your eyes.
I admit it, but I love hearing your point of view.
In your eyes is, if the only reason there's an individual mandate, which used to be a conservative idea, John Chafee, Bob Dole, Republicans push this, is it's the only way to get to universal health coverage through a private insurance market. There's no question that Medicare and Medicare for all is totally constitutional. So if you can't use private insurance markets to expand coverage to the 50 million uninsured, which is what this is an attempt to do, harnessing conservative means to somewhat liberal or progressive ends, then we're going to see when the dust clears that conservatives will be finding that the outrage over the injustices and the inequities in our healthcare system are going to put us on the slippery slope to single payer.
All right.
I mean, what Judge Vinson said was.
I just want to make this point. Diana, hang on one second. I just want to make this point. Part of the judge's decision today, this is very important, is that Medicaid was allowed. He did not rule against any federal mandates to the states regarding Medicaid. Now, Diana, please continue your critique of what Matt was just saying, that this is the best deal possible because if not, it'll lead to single payer.
Well, I just wanted to say that Judge Vinson says the Constitution that we cannot regulate inactivity, and that whereas the government can regulate activity under the Commerce Clause, it cannot regulate inactivity, and someone not purchasing health insurance is inactivity. Just like his prior broccoli example, you can't mandate people to eat broccoli because it's healthier. But just to get back to the private sector and having different plans competing, the way there is with the federal health insurance plan for employees, they're offered a wide variety of plans. They can choose inexpensive ones or expensive ones, or they cannot choose one at all. If, for example, we wanted to require people to purchase health insurance, you could do it as a condition of getting some other benefit. In other words, if you want to collect Social Security or earned income tax credit, you would be required to buy health insurance. The problem with the health insurance mandate isn't that it's a mandate, it's that it's so broad and expensive. It's a Cadillac plan. Younger people are paying towards the costs of older people, and you don't have a choice of a catastrophic health plan, a basic health plan.
So, Matt, let me just inject this, though. What's wrong with the kind of choice that the senior executive service and members of Congress and their staffs has, and what's wrong with redoing Obamacare so the individual has the choice that he or she will get the tax break and shop around for what plan works best for them. Isn't that the best approach?
And by the way, it's all federal employees. It's not just the senior executive service.
The federal employee approach is a fine model so long as you make sure that individuals have access to group rates and can't be denied for pre-existing conditions, etc. What we have not seen in this entire debate, and I'd be happy to repeal Obamacare if Republicans would pass, or if the Republican House would pass a plan that the CBO certified would ensure the same 30 million of the 50 million that the Democratic plan did, but did it at lower cost. I'd sign on to that in a second. I haven't seen any Republicans. You show me John Boehner or Mitch McConnell ready to spend the money on people who don't vote Republican. But that's their objection.
But that's because some of the 30 million, some of the 50 million who don't have health insurance don't have it, not because they can't afford it, but because they choose not to get it. Some of them are in between jobs. Some of them are young. They just don't want to get it. And so that's why. The question is, as Judge Vinson was saying, can you force them to purchase it?
But Matt,
and he was saying no.
The real Paul Ryan argument about competition is that only market competition will truly hold down costs. And that is almost a universal given, Matt. Why won't it work in healthcare like it works in every other economic sector?
Well, first, we don't have a free market in healthcare, but we do have, today we do have the most private sector-oriented healthcare system. Outlier. We spend 17% of GDP. Everyone else spends 10 to 11%. Singapore spends 4%.
Matt Miller, thank you. Diana Furchtgott-Roth, thank you. The judge in Florida, thank you. That's it for the